But the indicators, if you look at health, if you look at education, if you look at jobs, if you look at infrastructure, there's a lot of variance between the indicators in the region versus the same indicators in mainland India. And we felt that it was very important to unpack some of this, to understand what the current situation is, what unique challenges exist, how do policy indicators, if you look at health, if you look at design, investment approaches, how do they need to differ to account for unique needs? Is that already happening? If yes, then how? If not, then why not? And what can be done about it? So that's really what we are trying to focus on through this series. In addition to this, we are also running a project on curating data sets related to development indicators in the northeastern states, and that will kind of feed our Belongg AI tool. So all in all, to say that we're super excited to actually have this discussion. And hopefully through this, we are able to get really interesting insights and ideas, which propel this whole thing forward. And again, thanks to all of the experts who agreed to join us, and also to EastMojo for agreeing to partner with us for this. The way we'll do this over the next hour and a half is first I'll introduce the experts and the panelists, and then we've got a bunch of questions that we'll go through, and really using those questions as a starting point. And there's enough. It's a rather unhurried kind of panel. We've consciously kept time because we didn't want to make this a 30-minute thing or a 45-minute thing, because that ends up being quite meaningless. So there's a lot of time. We'll explore issues in somewhat of a detailed kind of manner. And then there's enough time also for the panelists to ask questions of each other and come in. And I think a lot of the beauty of this conversation will be the interactions that all of you might have with each other. And then towards the end, we'll keep 20 odd minutes for the audience Q&A. And I think we'll keep curating questions on the Zoom chat here, but also I don't know if maybe we'll also curate any comments that are happening on the YouTube live, and then try and answer those. So Sanjana and the EastMojo team will help us with that. So with that being said, let me begin with quick introductions to the panelists. I'll start with Manisha. Manisha Datta is a development professional who has lots of experience working in rural and tribal communities in India. Her expertise is in program design and strategy, stakeholder partnerships, program management, and qualitative research. And she's also led regional teams at the state level and has anchored projects at significant scale and created impact. Welcome, Manisha. Dr. Marchang Remingam is an assistant professor at the Center for Study of Social Change and Development, CSSCD, at the Institute for Social and Economic Change in Bangalore. He specializes in the economics of labor and then migration studies, and also human resource development and regional development focused on the northeastern states of India. So welcome, Marchang. Thanks for taking time. Then we come to Supriya Gaunt, who's an independent sustainable development consultant and facilitator who works on nurturing individuals and organizations who have an intent towards systemic change. In the past, she's worked with the UNDP, the Northeast Network, Bloom Microventures, UNESCO, and various governments in the policy creation and dissemination realm to integrate, align, and accelerate the achievement of SDGs. Welcome, Supriya. And then finally, we've got Dr. Rail Rocky Zipa, who's an assistant professor of sociology at IIT Bombay. He was a 2017-18 Raghunathan Family South Asian Fellow at Harvard University. His research interests also include socio-anthropology of infrastructure, sociology of development, indigenous and tribal studies, and Northeast Indian studies overall. He's the author of Infrastructure of Injustice, State and Politics in Manipur and Northeast. Welcome, Zipa. Okay, so really excited again to have all of you. Thanks for taking time. I'll begin with a macro question, which I'm sort of addressing all of you, and then we can maybe go in the same order of the introductions. So the question is, how, given your vantage point and given your kind of experience and the work that you do, how do you define development in the Northeast region, particularly for the most vulnerable populations? So A, how do you define development for those vulnerable populations? And then also, how do you define vulnerable population in the region, right? And there might be heterogeneity in that as well. So if we can have Manisha start with that.
Thank you so much, Neeraj, and thanks to the Belongg team for this opportunity. I speak of development from a public health perspective and a very sort of implementation perspective because that has been an area I have been into. I think when we talk of development in the context of public health in the Northeast region, we must first begin with an acknowledgement of the complex socio cultural and economic and political factors that affect the health outcomes in this region, as you had also rightly pointed out, Neeraj. And this has to be acknowledged whenever we are talking about health equity. I mean, health equity, of course, becomes the premise of development, right? But that has to be acknowledged whether we are designing a program at a district level, at a state level, at a block level, at a community level. So it comes with this first underpinning. The second thing is that it has to reach the last mile, the vulnerable populations. So by last mile, I don't just mean the geographically last mile. I'm defining vulnerable populations here as the tribal communities, the remote, the displaced, the migrant communities, the persons living with long-term illnesses or any kind of illnesses like HIV/AIDS, TB, right? And all the socio-cultural stigmas attached to it. I think they are also one very significant population of vulnerable population we should consider within public health. Women, children, and LGBT queer communities, and how are we designing programs around that? So I think this accessibility and equitability has to be considered when we are considering these entire range of vulnerable populations that I am talking about. The other thing is, I think when we talk of health, it is high time now. We are in 2024, 2030 is when our SDGs are we need to achieve the goal of SDGs, right? And I think it's high time now within the entire scope of public health. It is not just having healthcare infrastructure or access to healthcare infrastructure. We are way beyond that. It is high time now we acknowledge what are the determinants of health that is affecting the health outcomes. What are the socio-political determinants of health? What are the other determinants like education? How is it interplaying? How is the quality of life being affected by rapid urbanization or political unrest that is happening? Or the behavioral practices like prevalence of teenage pregnancies, etc. So this has to be embedded within public health, and we need to have parameters, monitoring measurements around these aspects also to measure development within the discourse of public health. That is how I see it as. Thanks for the question, Nirat.
It's really interesting that you're saying that it's so important to cast a wider lens and actually, instead of treating it as a purely medical issue or a health issue, you actually have to have these larger kind of concerns also get counted when you're designing health programs. And thanks for sort of flagging those communities which need special attention. I'll turn to Marchang. What's your view on this? How do you define development and how do you define vulnerable populations in the Northeast?
Yes, in fact, first of all, thank you for having me here for this interesting discussion. Yes, I think the notion of development and the definition and the concept may vary from perspective to perspective, aspect to aspect. But in general, what we see is development is the occurrence, the changes which is happening from lower to upper state or from the least to more state, something like that. So I will to me that development is a state of I mean in relation with my, like for example, like in relation with my studies, particularly emphasizing on the migrations, labor, economic development, human capital, and so on, that to me I see like development is a state of achieving incorporating like higher human capital with gender parity, without the differences between women and children, men and female, like for even for the vulnerable section of society, irrespective of their locations or their settlements areas, or for the social parity, like irrespective of the the societal nature of society, condition of society, like for example, like the underdeveloped social community or the advanced social community, like that, particularly in resource access to in order to equip for labor employability in the highly competitive labor market, because nowadays the labor market is very competitive because of the change in the nature of structure of employment, structure of economy, structure of demand of educations, as well as aspirations of the various high-end employment as well as wage. So this may be through migrations or otherwise. Maybe the migrant may achieve, migrant may aspire, migrant may expect, a migrant may similarly try to reduce the gender parity, particularly in like ways or for in accessing or acquiring the human capital like education, or otherwise means non-migrants. And wherein the productivity, I feel that productivity should be significantly high for rapid economic growth, economic development, which in turn may create certain sufficient job opportunities in order to reduce the joblessness or unemployment, particularly for the vulnerable groups or the marginalized groups or the socially deprived groups. And you were asking about that marginalized. How I see marginalized not necessarily only in terms of the societal angle, societal aspects like ST, SC, OBC, or even the religious minorities like Muslims, Christians, or Buddhists like that. But I rather put in such I rather put marginalized populations in terms of the economic class, economic groups, like in terms of the income distributions or the household income distributions or the per capita income distributions or their wage distributions across different maybe different groups in terms of DSA, maybe, or in terms of per quarter. I think the least population in the least groups in terms of, let's say, income group, I feel that they may be considered as marginalized rather than in terms of underdevelopment criteria like lack of educations, lack of employment opportunities, because these are all relative terms, relative in terms of deliverance of the governance opportunities, deliverance or accessibility of the to the resources which are available from, and which are which in turn are accessibility, which are in turn are different, vary from state to state. For example, some states delivers more, have more, and access more, and as well as programs and policy formulators, as well as the implementers. Their attitudes, their practice are also vary. Because of those factors, I feel that the income may be a better classification for the marginalized rather than other social criteria. That's it.
Thanks for sharing that. And we'll maybe as we go forward, we'll definitely probe if there are some other correlates of that economic marginalization in the region. So we'll definitely come to that. But thanks for sharing that. Supriya, over to you for your kind of take on this.
Yeah, thanks, Neera. Thanks to both the EastMojo team and the Belongg team for having us here today. For me, development as we see it now versus sustainable development is the biggest question. Development as we see it now is completely based on a growth mindset, primarily to do with infrastructure development in all aspects, in all socioeconomic aspects. And I personally don't think that that is the way to go. We are talking about sustainable development at length. However, there's a very fine line between development and sustainable development. And sometimes in the name of sustainability, we tend to give focus to nature, but then we tend to prioritize the development over nature. We are talking about a balancing act between the economics, the social, and the environment. But even when we look at most of the infrastructure projects that we are doing in the name of development, there is a big question mark on the environmental aspect of most of the things that are happening, especially in the Northeast. In the case of marginalization, I think the biggest thing that comes to my mind is the underrepresentation of voices in the policy planning processes, because there are women, gendered voices are usually never part of the discussion. There are civil society organizations, that come in the initial policy planning process, but usually voices at the margin, the underserved communities, gendered voices, people with disabilities are usually left behind. So that is a big drawback in our current system and has to be addressed.
Thanks, Tupi. And we'll really come back to that and probe that a little bit more deeply as we move forward. So Zipa, what's your kind of take on this?
Well, thank you. I felt that development has become a buzzword, or should I say the most abused term, even if it talks about in the context of what's happening around. So for me, development means that embodies the idea of consensus, the question of, participatory processes, the question of equality, deepening of democracy, the realization of justice, and the foundations of a just society. In fact, I kind of echo what Tribal Intellectual Collective India called these processes as development with justice. So this would entail addressing the historical injustice perpetrated by different stakeholders against different communities. So development that addresses the questions of historical injustice matter to certain communities like tribes. So coming back to the questions of vulnerability, or those who are at the margin of the state, or those who are denied agency, for me, I would put that as part of these vulnerable questions. And we have to really address the question of justice, which Supriya have also pointed out in terms of its relation with nature and other human and non-human relationships, for that matter. Yeah.
Yeah, no, absolutely, fully agree that there's a lot of historical kind of justice that needs to be, and this whole thing of agency, I think that you even Supriya and others have pointed out. So that's exactly what we want to get to, as in through this webinar series, trying to understand what that looks like, right? What does agency really look like? How does participation, how can be fostered? What do those processes need to change, right? What does that change look like? So we'll definitely spend a fair bit of time on that. But let's get into the details a little bit now. So I'll turn to you, Manisha. So you've done a bunch of work on healthcare, and the Northeast region has a bunch of challenges in healthcare. The high maternal infant mortality rates. The Assam kind of rate is about 4%, which is higher than the national average at 3%. And there's a lot of, because of topography, because of other concerns, there's a lack of adequate infrastructure, health personnel. There's a lot of, I think, isolation just in terms of remote areas where the coverage is even poorer, right? So given this background, what has, if you were to think about the barriers to equitable health, do you think, the geography, etc., how much of the gap is explained by geography? What are the other barriers? You talked about how one needs to even have a wider lens, right? How it's not just a medical thing. One has to account for all of these different factors. So can you get us a little deeper into the real reasons why these barriers to equitable healthcare continue to persist in the northeastern states? And then also some examples from your work where some initiatives, maybe even bottom-up community initiatives, can succeed in addressing these equity gaps.
Yeah, sure, Neeraj. I think when we talk about equitable healthcare, I will talk in two sets actually. Firstly, for equitable healthcare to happen, I think in any society, the primary healthcare system has to be the strongest. In the public health space, this has garnered a lot of attention in the recent years. I mean, that, we need to invest in primary health care. And this needs a lot of shift from understanding that primary healthcare is just basic healthcare, which is not. Primary healthcare is the core of all the healthcare solutions that we are thinking of. Not all, but most. What do I mean by that? A healthcare that is accessible, closer to the community, provided by a set of people who know the community, who are well versed with the community needs, who are sensitive to the community needs, and is comprehensive in nature. So it is taking care of preventive promotive healthcare and also providing the primary healthcare services and a good referral system. So that is from a very public health sort of idea that I'm talking about, and that has to be strong. You keep on having hospitals, that is not going to be the solution for equitable healthcare. The other part is, if we have to look into the gaps within the entire understanding of equitable healthcare, we have to use a systems approach. So systems approach give us an understanding of the supply side and the community side and the interplay or side, what are the gaps that is happening. So from the supply side, yes, funding, infrastructure continues to remain a challenge, and the availability of trained healthcare workers. So when I say trained healthcare workers, again, these are not just physicians, right? Now there is a lot of talk around how we can build the other cadres like the nurse-led practitioners who can take up more significant chunk of work where physician availability is so less, right? The recognition that traditional birth attendants in geographically inaccessible areas can play a very vital role in referring and accompanying pregnant women to the nearest hospital, right? So all these are elements that within the public health discourse has to be really emphasized now, really have to be invested on. And working in Meghalaya, I'm seeing how much the nurse-led sort of primary healthcare is being given so much of importance, their trainings and the attempt to also place them within the same community that they come from actually. So this is one system side things. Of course, availability of diagnostics. We are talking about technology in health. I think one of the biggest things that come with technology in health is not just designing a diagnostic thinking that it's a one size fit all approach, right? Something in Meghalaya may work, which might not work in Bihar. So that cultural sensitivity, it is not just appropriate cultural appropriateness. That's a very low term. I think that sensitivity is very important, whether you're talking about technology as an enabler in health, right? Or human resource, who are you placing in these services? Availability of course, diagnostics and medicines, which is very important, and I'm sure the National Health Mission is also emphasizing on it, and all the state governments are now focused on it. But let me now talk about the more important and I think significant part, which is the social fabric and how is it sort of, it is becoming like a barrier for equitable healthcare, the political unrest that you see, right? And Northeast is in a very strategic location. It is sharing borders. There are conflicts that we are now aware of. We are seeing what is happening in Manipur. And you think of a situation there and then think of a vulnerable population. Let's talk about this particular household which barely earns meager income in a place where internet is getting shut down. There is so much of unrest. How do you even imagine them to be accessing services? My teammates have shared about environmental sustainability. You see climate change impacting, right? We are seeing floods sort of damaging the entire landscape that we inhabit right now. And then the question comes, how is the healthcare designed or tailored to meet the needs of those people out there? So that is one question that comes. Behaviors, right? Now, there is a very instinctive tendency of looking at certain behaviors as, oh, that is a behavior that is going against positive health practice, right? But one needs to delve deeper to understand the social significance of a behavior and how you can weave within it. So for example, I'll give you the context of Meghalaya because we are primarily working with the communities there. There is a huge no for family planning in Meghalaya. And it is voiced by a lot of religious assumptions that family planning curbs what God actually wants, etc. And this is in different regions, there are these socio-cultural beliefs around certain things. Now we can go outright and say that, hey, your behavioral practice is a no, you need to do. Or we can be more empathetic. We can be more sort of understanding of what is stemming from this, what is leading. Who are those social actors we can involve within the healthcare design who can actually promote the benefit of family planning, right? Similarly, for other illnesses which are so taboo, like tuberculosis, right? And people don't go and seek care in the health services because of a lot of stigma attached to it. Who can we loop in it, right? Traditional healers, right? How can we bring them in? I talked about traditional birth attendants. Instead of seeing them as the other side of the medical, this one, I think they play a very huge role in mobilizing the community. So all these, very intricate and very sort of important nuances that play out within the socio-cultural fabric needs to be recognized, right? In the healthcare design, these cultural linguistic barriers have to be addressed, whether you're designing a digital app for health, whether you are designing a program for health, you have to be cognizant of these aspects. You have to bring in the social actors who act as the influencers for health change, and we have seen that result. Instead of going by the traditional approach of, oh, asha hai, so let's make use of the asha for mobilizing, we are now bringing in different kinds of social actors who are from the community. They are like the local influencers. We are making them see, we are not disrupting the social structure. It is still there. In Meghalaya and in Nagaland, the village council is the most pronounced social system in every village. So we, as public health professionals, we cannot just go and disrupt it. So we have to sort of recognize it, respect it, and we are using them to make sure that people are able to access healthcare. People are changing their behavioral practices, understanding the value of different health related issues and how they can work on it. So I think I've given you a larger landscape of where all these gaps exist and how we can address it. Yeah.
It is fantastic. And I really like the example that you gave, which makes it super real, right? So the importance of not sticking to assumptions that might have worked somewhere else and actually being very
Yes.
responsive to the local context
Yes.
and also co-designing with that local context and the affordances you have, right? In this case, the Asha may not be the right choice for a certain program given the traditional kind of feel. So which actually sort of brings me to, it's a nice segue into the next question I want to ask Supriya. Supriya, this is more macro and actually looking more at gender. So there are, like we've discussed a little bit, there are heterogeneities and lack of equitable access to all of these services, healthcare, education, employment, and even infrastructure. And lots of marginalized populations are Northeast, indigenous communities, women, they probably face more pronounced barriers, right? And then even in these 8 states, there are other states where there are tribal communities which are extremely remote and might face even more exacerbated access, right, to these things. And let's say there's gender-based discrimination, so women and girls are less likely to receive education, healthcare. So it keeps on compounding. So based on experience with UNDP, can you just talk a little bit about the kinds of barriers, systemic barriers, unique sociocultural barriers that you might have encountered in your work in the context of gender inclusion within, let's say, livelihoods or even in other topics? How do these barriers present challenges for gender inclusion in sustainable development?
Thank you, Neeraj. So when we look at barriers in the Northeast, nothing can be looked at in an individual perspective. Like, it is so interconnected. It's like the part of a giant system, and one thing falls and there's a domino effect and it affects every single indicator. In terms of what I totally resonate with Manisha was saying, and I'll start from that, because one of the things that is happening is that women, as we know in Northeast, and Zipa will know a lot more about this, is that women are the custodians of indigenous knowledge systems. And these are extremely, extremely strong, go on for generations with hundreds of years of knowledge that sometimes are not documented, but they are strong indigenous systems that exist. Now, there's a whole culture of where this is slowly getting eroded, or it's not even recognized. And women as custodians of all of this knowledge in most communities are not recognized. In some states, women don't have land rights in the Northeast. They're still fighting for land rights. In some states, women are just getting representation in the political spaces. And it's very late for some of these things to have to happen. And even in like our recent elections, only about, say, 12 to 8% of women representatives were elected in all of, on an average across the Northeastern states, which is extremely low. Women are still doing most of the work. May it be in terms of unpaid household work, care work, community work, because women if you go to a northeastern village, you will see how many festivities. It's just surrounded this, and the community is all together. The amount of time and support women give to these activities is as crucial a part of their lives. None of this is recognized. And then women are also they're also rearing animals, and every household has at least 2 to 3 livestock, which they're doing. And again, none of this is, taken into consideration. In terms of livelihoods as well, if you look at women in agriculture, women are still not recognized as farmers. A lot of women, when they go to get their, say, farmers cards, a lot of women are actually they have huge barriers in terms of recognition as a farmer. We know, and Manisha pointed out, the effects of climate change. A colleague of mine was just mentioning how they're working in a remote part in Nagaland, and her farmers had to sow seeds millets 4 times this year because of the changing excessive heat, the excessive rain, and doing the same thing again and again because it's so unpredictable. There is no insurance in terms of these crop losses. And even in the other sectors, because in Northeast, if you go to, say, Manipur or to Mizoram or even in Assam, you'll see a lot of the women are street vendors, waste pickers. There's this whole other informal community of women as well. And most of these women, again, do not have collectivized voices. Again, there's another set of discrimination that happens against them in these spaces. And when you're not formally collectivized in terms of, say, climate change, there's a flood or there's excessive heat or there's a sudden cloudburst. These are now happening everywhere. So what is this in terms of disaster preparedness? How are they affected? They're affected the most. And already we have people in the margins, and it's just going to get worse. It will continue to get worse. And I think if these measures, if we are not looking at people in the margins, if you're not looking at people with disabilities, our queer community, if you're not taking their voices and collectivizing, helping people have platforms to raise their voices, it is going to affect. If we look at the Government of India's national climate change adaptation policies and a lot of the programs that are implemented in Northeast India, I was just reviewing the process of how they were designed, and there was no gendered voices included in any of the design part of it. Usually, when we realize that most of the policy planning that is done quite top down, but then sometimes there are inclusion of civil society organizations and voices from there. The projects are great, but then if you don't have gender voices within it, I don't think it is sustainable.
That's such an important kind of epistemic kind of gap that you're pointing to. And why do you, if I can just press you on, why do you think that's the case? Is it because it's not valued, the decision makers and the policy makers, they're not actively seeking feedback? Is it that there are process failures? Is it what's really driving this lack of voice showing up in the design of these things?
Yeah, I think there's a giant process failure. There has to be, right from the beginning, sometimes these designs come in a very, like there is money to be spent, let's spend it. And we have a very quick timeline. Like, you know how organizations run. Sometimes also within big systemic places, there are these like project mode on, and we have to get project mode on as soon as possible. It's not possible to go to each of the villages. It's not possible to get all of the stakeholders. It's a time-consuming process, but we need to get our turnover as soon as possible. We need numbers. Also, it's a numbers game. So I think in this whole hurriedness of doing something, the intent may be right, but the background work towards actually making sure that this is actually a sustainably developed project for the long run, not just for us, but the communities and their children and the biodiversity around it, gets lost.
Yeah, this is such an important point you're raising, Supriya. And actually, which brings me to this other topic that we might examine through the same lens. And I'll come to you, Marchang, obviously talking to you about employment, labor markets, migration. So the common kind of discourse is that the employment opportunities are limited in the region. There's a lot of out migration as people seek better prospects. There's a lot of informal employment in the region and lots of low-paying, unstable jobs. And the situation is very acute in certain states like Meghalaya and Tripura, where the traditional industries have declined and new industries have really not grown and taken root, right? And this not only drives out migration, but also contributes to social instability, right? So you've done a lot of study on the migration patterns from the Northeast. What are the reasons for this, right? What are the social, cultural, economic factors that drive this? That's number one. Number two, how does this drive the local labor market and economic growth in the long term? And I'd love you to also touch the piece that Supriya was talking about how, because there's a lack of voice in the design process of policies, let's say, that are related to job creation, or do you think we are missing a trick because that voice is not showing up? If the right voices were to show up, then you'd actually have better employment policies, better job creation potential. So yeah, I'd love you to sort of cover these things.
Yes, I think that various factors are interplaying, particularly for this process of migration, as well as like employment opportunities and the inability to access the opportunities, particularly the employment. But if we relate, since the topic, I mean, since the discussions theme is relating with the sustainable development, I think the perspective changes, the perspective on the sustainable development, particularly on employment or decent job and all, changes once the process of migrations takes place. For example, I've studied couple of studies, particularly for migrations, and what happened is that the social exclusivity or the employment exclusivity, or in other words, the gender mismatch, particularly in the labor force participations. If we see the scenario starting from the scenario, like for example, if we see the labor market participation, labor force participations between the females and the males, we see a wide gap. And also if we see the unemployment rate between genders, in order to map the gender parity, what we see is that there is a wide gap, which shows that there is a difficulty. Women in particular are having difficulty in accessing to the labor market information, to the labor market opportunities. So that is one of the driving factor for out migrations. So what we primarily feature for migration is the unemployment, which in many literatures, as well as in a couple of my studies, also have noted that migration in unemployment, the joblessness, the unavailability of the employment opportunities, irrespective of whether they are marginalized or whether they are advanced economic group or social group, there are different layers, different magnitudes of inaccessibility. That means inability to get job in their respective states. That is originating from various features. One is from the social factor. It is social features, cultural. It also associated with the cultural phenomenon, and also economic phenomenon. Economic, particularly the lack of employment opportunities, which you have also highlighted about the lack of industrializations or the diminishing industrial or decaying industry, MSME and so on and so forth. But what we fail to observe, particularly in the Northeast, is that the big industries are not growing. For example, special economic zones have been notified for several states, including Nagaland, Manipur, but none of them are functioning to the expectation. So that creates joblessness, that pushes people, particularly the educated class, to outmigrate from their respective states. So what we see is not only economic. Economic is a consequence. Economic opportunity is the consequences of the lack of educational opportunities, which are amalgamated with, and also blended and complemented and supplemented to each another, particularly for out migration. It's not only a lack of economic opportunities in the origin of the states, but also the lack of educational opportunities associating with the or accompanying with the lack of employment opportunities is driving for out migration. And the phenomenon which academics usually omit is the cultural factor. We are not talking about the culture which we practice from our traditions and all, but the cultures of, particularly in the Northeast, the culture of insurgency, the culture of war, which is happening at the moment in the state of Manipur, is resulting to internal displacements as well as out migrations, which is affecting to the not only to the origin of the state's economy, but also influencing or change, having a capacity to alter the migration destinations' economic status or the employment avenues. And the other one is the social factor, which we should also not neglect. Particularly, we see that over a period of time, the pattern of migration changes from northeastern regions to different states, and the social order where we talk about the disorder conduct of the society, particularly the agencies. Like, for example, the civil societies, you may be well aware of civil societies, defending as well as promoting the social order in the state of Manipur, for example, currently taking an example. And the security, the militants, all these are creating a fear factor, a social phobia for the people who are supposedly be a peaceful people, now has embedded with the fear psychosis, which is leading to out migration. And yes, of course, the other social factors which we normally pin in the discussions in the out migration is the education, and also the marriage. We thought earlier, even the secondary data, big data like the census as well as the NSSO data also captured that employment and education are not very prominent reasons for out migrations comparing with other regions other than employment and the education. Means marriage is also playing a very marriage is contributing immensely in the out migration, particularly in the nearby proximity regions to the northeastern regions. And the factor which we think is not exclusive for out migration. It's an amalgamation, mixture, and blending of these social, cultural, as well as economic factors, which is pushing out for out migrations to various cities in the country as well as abroad. The marginalized, to me, the marginalized can be based on the social strata, based on the class, regional strata, based on the income strata. But I emphasize on income strata, income growth. What we see is that the out migrants, if we see based on the income group, out migrants mostly are from the middle income group, and largely are from, significant proportion or share are from the lower income group. That means in terms of margin, in terms of income group, the marginalized groups are also out migrating from northeastern regions to the elsewhere states of India. And second thing is that when we talk about the parity in terms of employment, the women's participations outside the state, the migrants' employment, women's employment is much larger than my employment rate is much larger than the counterpart male's employment rate. That shows that it's not because of the it's not only because of the opportunities. It's also because of certain social social structure which is and the system which is existing in the northeastern region. For example, the patriarchal, maybe strong patriarchal system, maybe also that like the notion that women should not walk outside the household. Certain things are interplaying for the push out migrations to the cities. The by considering that migrants are not unemployable unemployable individuals. Migrants are employable at large, particularly in the sectors of like retail, in the sectors of hospitality, as well as in the sectors of the corporate sector. That shows that they have skills. That shows that that shows that otherwise, if institutions or the industries or the corporate institutions are established in the northeastern areas, the employment rate may increase, as well as the unemployment rate level may reduce. By doing that, the joblessness may also reduce, and for women, in comparing with the male, they may be empowered in terms of economic decisions or what we call like political decisions and other decisions. The other question which we are asking about the impact on the labor market and the economic growth, particularly in the regions due to the out-migration, is very significant, but at the same time it is disheartening, because out migrants reduces the unemployment rate levels in the labor market, particularly in the short run, in the northeastern regions, despite having a low industrialization or economic underdevelopment in the northeastern region. But at the same time, it lowers the quality of the labor and also efficiency of the labor productivity, whereby reducing the productions as well as the contributions in the state's income. These may eventually slow down the overall economic growth in the state of origin. I think that dismays in comparison with the advantage of out migrating to the other states of India. Therefore, for sustainable development, if we see the sustainable development goal, particularly for getting equal opportunities, equal ways, or a decent job, having a secure employment, having a social security, those things, aspects, may be effectively promoted by the government by introducing and also inviting the private investors in order to establish the employment opportunity avenues through their industries, through their corporations, through their various institutions. And at the same time, it may be necessary that the informalizations of the labor force, which is very large, particularly in the northeastern region, informalization of labor force, particularly of women who are engaging largely in the agriculture sector, as well as household unregistered manufacturing sectors, are very large, which needs to be may not be formalized, but may need to constitute certain employment security, certain social security, not employment security, social security, in order to safeguard their lives and livelihoods during the contingencies of unemployment, during the contingencies of flood. For example, floods are very prominent this year, or during the times when they have when they lost their income, like in the COVID time, or during the times when they have faced when they are internally displaced across the states as well as within the states, like for example in Manipur. That's all. Thank you.
Yeah, thanks for laying that out. I think in quite some detail, Marchang, and I think we'll come back to the pieces that you said, that there's a bunch of labor market impacts, how one needs to have what I'm picking up is the need for a hybrid approach, which actually obviously is trying to attract larger kind of industry, the SECs, while they're not working, but also almost the other side of it, bottom up, taking care of these inequities and these social kind of norms and these gender norms, which are preventing participation. So we'll come back to some of that. Let's now turn to Zipao, and let's talk about infrastructure, which is almost like the connective tissue between the different pieces that we've discussed, right? So if you look at healthcare, if you look at employment, so some facts, I mean, the terrain is of course difficult in the Northeast. There are lots of hilly regions, forests, which complicate matters a little bit in terms of developing transport links, railroad, air. And some states are more poorly connected than the others, Arunachal, Nagaland, and Manipur. The density of roads is lower than the national average. This obviously, as we've spoken previously, leads to limited access to healthcare. Even things like industry find it more difficult to operate, and marginalized groups are most affected. So you've done a lot of work, Zipao, and you've written about this in your book, Infrastructure and of Injustice, which first of all highlights the role of infrastructure and then talks about challenges. Can you just talk about how development of infrastructure or the lack thereof has affected the region, especially indigenous communities in the region, and how has that led to differentials in healthcare, education, employment, and even other things that we may not have talked about?
Well, infrastructure is one of of course, my favorite topics, and I've written and published few work on the domain. But what is interesting to note in the places like Northeast, that infrastructure build out in the region, it's ensnared in the binary space of military versus civil infrastructure, like valley versus hill, tribal versus non-tribal areas, centered versus alternative center, and so on. The polarizations of this binary space is the key to the questions of justice in terms of infrastructure distribution and investment. And for that matter, which like Supriya has also talked about in terms of accessibility, even a gender lens. So the notion of this infrastructure deficit cannot be generalized and applied across the region and states. So for instance, the poverty of infrastructure is mostly seen and experienced in tribal or hill areas or alternative center or in civilian spaces. Look at the cantonment areas in northeastern state, or like that kind of these military infrastructure which we have. So what is important for us to note is that fundamental to the life of this physical infrastructure is its intrinsic connection to land. Infrastructure is built on land. Land and identity among tribes are intrinsically related to each other again. So mega infrastructure invariably fragment land, village communities, and also identity. And the fragmentation of the holistic constructions of identity in the process of infrastructure build amounts to what, injustice, and create varied kinds of conflict within the community, vis-a-vis community and state. So infrastructure is as much as it's connect and builds network, also in fact destroy community structure and identity. So when land is turned into a commodity, and the state and dominant community appropriates such land for infrastructure development, the original inhabitants lose control over their land, leading to what I call injustice. And more so, when the benefits from such infrastructure development is not accrued to those communities, which is often the case, then it perpetuates injustice, or what I call in my book, infrastructure of injustice. So with such development, a new governance system comes into play, and the tribes or indigenous people are forever dispossessed of their land. And here it's important for us to note that in Northeast, or in Manipur in particular, ignoring the very fabric of, or the very multi-facets of marginality and injustice perpetuated by different agencies, it's like denial of ethnic minorities' existence. And more so, what is interesting to note in these new politico-economic regimes of the new liberal era, the push for this mega infrastructure development as the basis for driving economic growth is often presented in the language and framework of modernity. So whose modernity are we talking about, And this approach to development has penetrated across northeastern states. And it started begun to alter the kind of reality that stems from this kind of experiences, and one wave of colonization has also been penetrated. Or one way one can also talk in terms of what is called developmental colonialisms. So here I wanted to come a little bit to the context of Manipur, which of course I've done a part of my field work in Manipur and what's happening in the current context, So what is interesting in the state like Manipur is the responsibility for the development in Belongg in the conflict-ridden border states of Manipur, in fact, lies with multiple agencies. Yet, each agency of the stakeholder finds an excuse, for the lack of development. And there is this general tendency among them is to blame each other, what may be called, scapegoat syndromes. So the tribals blaming the non-tribals blaming the tribals, the state blaming the insurgent blaming the state, and whatnot, the list goes on. And quite interesting, the unique aspects in the state like Manipur is the political life of infrastructure. Non-human agencies enveloped in a shadow of this ethnic contestation, and insurgencies steeped in corruption. And the Naxals reveal what is called these contemporaneous development practices. So this opens up a new avenue for us to unfold the spaces of injustice as well as sites for protest and negotiations. And one can also try to understand the current kind of conflict through the lens of land and infrastructure, and for that matter, even in terms of accessibility.
Yeah, I'll just, this is fantastic. I really like the way you framed it. Basically, you're saying it's not, the averages should not be trusted in the Northeast when it comes to infrastructure, because it's a binary, right? So there's stuff that is very, very well developed, and there's stuff that is not developed. This whole military versus civil infrastructure, hilly versus plains, tribal, non-tribal areas, and the infrastructure. So the average is kind of meaningless. It's actually these things. And then the way this happens is extremely sort of not participatory. So can you give me some examples of how, if you've seen anything that has been developed which is more participatory, let's say where the need for a certain piece of infrastructure, let's say a certain road has come from the community and that's been actioned. Have you seen any examples that you think should be replicated and scaled?
Well, my favorite example, I think I'll go back and talk about in the context of what is called the People's Road, which was built in Manipur in Belongg district. It was built within, 7 months and 100 kilometers of road without any government support. Of course, it was led by the young IAS officer whose name's by the name called Amton Pamai. In fact, how the community in itself felt the need to carve out their own infrastructural space when the state fails to step in. So it's like a community-driven sort of initiative wherein the villagers, in fact, voluntarily come forward and donate whatever possible from their end in terms of, volunteering labor, in terms of donating a small amount, or for that matter, even cooking a meal. And why is those, it's quite interesting to see in a way that it kinds of, one could able to revisit the kind of what we call the egalitarian principles in a way in terms of development. But here, those kind of values, the philosophies is being reflected, wherein when there is a denial of opportunity, it doesn't end there, but there is also rather a community-driven infrastructure development. So this is, I think, very common to many places, particularly, I should say, I'm from the hill areas of Manipur. So for instance, roads become a liability if it doesn't maintain. And more so, many of the roads which are constructed under PMGSY, for that matter, never see this inauguration stage. Instead, it fades away much before it is being inaugurated. And since there are no maintenance, they have been pursuing, but there's no maintenance. It is the community that initiates and that also take years of their own infrastructure. So what is important for us to note here is that the moment community take the ownerships of such infrastructure, one could also see the way how it penetrated. Otherwise, the moment when such many infrastructure are not, say, oh, this is government ka building, or this is government hospital. Nobody really cares about the very aspects. What we lack is that in terms of the ownership. So the moment we take this ownership and change little bit in the framework of the governance structure, I think there can be a way forward in terms of looking, infrastructure, where we can look forward something like resilience infrastructure, or sustainable. I don't know whether this infrastructure can at all be a sustainable development model for that matter. Yeah.
Yeah, that's such an
Neeraj,
important
I
point.
want to add in here, I think Zipao made a very vital point, and I've seen it myself. In Meghalaya, the entire onus of, constructing health and wellness centers are given, the contract is given to the villagers to decide. So that the idea of community ownership, when you can really see it, it's not just them building their own health facility. You see them then asking for the right kind of demands. They need electricity, they need a nurse there. You don't see that kind of participation in many places. There is no doctor, okay, fine, we will go to another place, we'll go to the traditional healer. Here, because this is something they have built it, they have owned it, that only sort of multiplies, the way they want to give shape to the hospital. The next thing you know, they are building a shed, they're building a quarter for the nurses, they're demanding for a nurse from their community to be positioned there. And this really sort of has a ripple effect. So I just wanted to come in here and sort of bring in that
Yeah.
perspective.
That's a great point, Manish. And actually, it's sort of coming back full circle back to you, actually. So this whole thing that the example that Zipao gave, and also the piece that you added, right, where you've seen these examples, and these then become vibrant pieces of infrastructure of services that actually get used, as opposed to being labeled as a government ka hai. So in your experience, what do you think leads to this, right? What are the necessary preconditions for people to come together to do this? And also, have you seen what can a public health professional take away from this? What are one or two things they can do to bridge the gap between the top-down sort of imposed healthcare system and this whole bottom-up, community-owned, indigenous kind of knowledge-based system? So what's the trick to get the balance right?
I want to start with this very I mean, this is anecdotal actually. In a public health gathering, I remember this one renowned public health professional really sort of commenting that Meghalaya has a lot of empowerment among women because it's a matrilineal society. That statement itself is so flawed because it comes with an assumption that yes, it is a matrilineal, so it is equivalent to matriarchy, and so women are empowered, and then they have the agency to sort of decide for their health services. Firstly, matrilineal is not the same as matriarchy, and within the entire cosmos of matrilineal that exists in Meghalaya, one has to acknowledge the very covert way in which patriarchy perpetrates when it comes to healthcare decision making, and how it sort of percolates and why it is so. So the first things first, as public health professionals, I think it is our moral responsibility to first understand the community we are aiming to serve or aiming to work with. As individuals, we have to understand them, the socio-cultural fabric that is existing, and not carry the assumptions. And I am not just talking about rural areas here. There are urban health projects. So how do we understand the urban health space? Somebody, I think, from the audience has also asked for successful healthcare programs. I think there are immense thinking has gone into designing the healthcare programs that we have today within the National Health Mission, right? But the idea is, how do we tailor it into the context that we are in? That is where public health professionals come in, whether it is the medico or non-medico. I mean, these are the linguistics that are used. Everyone needs to participate, needs to understand the community dynamics, needs to understand who is the one that is going to be that liver, who is the one who is going to be the beneficiary. What are the dynamics, what are the behaviors, and not be judgmental. I think a lot of empathy in here like sort of comes in. Second thing is, while we talk about participatory approach at the ground level, of course that is very much necessary, whether we are talking about the program design, implementation, or M&E. In the M&E part, by the time I think implementation is the part where participatory approach is used, and in more senses, community is seen as the recipient, the passive recipient, and not as active participant. I think it is high time that we take lessons from different parts of the not just country but also everywhere else, where community is involved in the designing of programs, community is involved in the implementation, yes, and also in monitoring and evaluation. I think M&E is one part that we have just not touched yet. And community's role in data, so to say, and they are not just there to give you survey responses. How can they make use of the data, right? So that is something very, very crucial. I want to also stress upon governance, because Neerath, a lot of this comes from the governance, the leadership that comes in. And successful programs have been successful where the governance have invested in this kind of a participatory approach, this kind of an intersectional approach, Neerath. And in Meghalaya, I've seen substantial examples. Nagaland has the village council. They, in both these instances, they give a lot of ownership, lot of liberty for the council to decide what they want for the health of their community. They are not defining that as a council you have to do this and this and that. They are letting the people decide what is important for them. So some village in Nagaland, they sort of, they had bought this sort of a bed where women can lie down when the antenatal checkup is done. That is something they felt appropriate. Some place in Meghalaya, they bought a stretcher, because that is the only way they can reach the nearest facility because of the hilly location. So without being very very particular about the do's and don'ts, that as a group or as an entity you have to do this, and we have to give the liberty to the community. And that comes a lot from the governance side of it, the governance being acceptable to what the community brings in, and also bringing together multiple stakeholders. Very, very essential, Neeraj. I think as public health professionals, we have to see this, and we cannot see health in silos. And I don't think WHO's definition of health is also only about, I mean, it clearly says it's not just absence of diseases, it's all the determinants coming together. It's a lot of hard work, but it is definitely possible. Maybe we can try at a very micro and then take the learnings to the macro stage.
That's a fantastic example. I love the example that you gave of the bed and the stretcher, because that exactly, I mean, that kind of discretionary kind of business rules almost, if you will, are what are needed, right, to drive this. And I think I want to, Supriya, I'll come to you and ask you for your slightly more macro view on the piece that Manisha kind of talked about co-creation, discretion, local needs, right? So a lot of policies, at least there's a lot of intentionality in large international development actors on wanting to create with local communities, co-create solutions, co-create designs of programs and so on, which are relevant, culturally sensitive, contextually relevant, especially in the Northeast. A, do you think there's enough of that happening? And B, can you give a flavor, maybe one example of what that actually looks like?
Okay. Thank you again. Great points from both the speakers. I had a lot of comments, but I refrained myself because I just wanted to jump in. In the context, firstly, let's say the SDGs and it's in rollout in the Northeast. Most of you must be aware the Niti Aayog is coordinating all of the activities centrally. They have this indicator framework, and then they have the SDG India Index, where all of the states are they have a scorecard and they see who's doing good, who's doing bad in all of the indicators. Luckily, all of the Northeastern states seem to be improving in most of the indicators. But the framework that is done, it's been kind of developed, I would say, at a governmental level, which includes that states can then take it all forward at their level. Now, how they have done this, and it's important to understand because it has been designed top down. So that's why I will have to start from top down to give you the macro picture of how SDGs has been functioning in this region. So states then design their vision documents, and these vision documents go up to the year 2030. The process of designing these documents, there has been some consultation, I would say, with civil society organizations and the state departments. After these vision documents have been designed by most Northeastern states, most states have done district level engagement. And again, when they go down to the district level engagement, they have consulted civil society organizations, but it has not been the other way around. Do you know what I mean? Like, so it has some gone the state, and then it's gone to the districts, and then districts have either they are having capacity building exercises at the district level, or they have been they have created district indicator frameworks, which is just to have like a sort of a framework to see what is important in our district. So there's a certain kind of localization happening there. Some states have taken down, I think Mizoram has taken down to the block level. When I was with an international organization, we had done some work in Meghalaya where there was block level engagement. And this is the sort of engagement that should happen, where block level representatives were there were citizens there. There were local organizations who also participated in this conversation. And these were then, in Meghalaya, actually, these were fed into the larger document. So it was a bit more bottom up. However, this was not done in all blocks. So this was, I don't know how this was utilized. It was done in a few blocks. I did not see the representation of all blocks in the process. So in this entire policy piece of SDGs, I think a lot more localization is required. The Indian SDG model, as described by the Government of India, it says it is about institutional ownership, it's about robust monitoring, and it's about developing capacities. But they use the word whole of society approach. And when we talk about the whole of society approach, I think it's really important to have these voices from grassroots up. However, as I mentioned earlier, some of this has happened top down, some of it has happened bottom up, but I don't know how it reflects. And also, it's really important in the larger Agenda 2030, the SDG agenda, it clearly mentions, and I can quote, I have the bit, I just wrote it down. It says, there is a need for systemic follow-ups and reviews. There's a need for having indigenous people, civil society, private sector stakeholders being included in their conversations. And it also says to include the poorest, most vulnerable. Now, when I'm talking about having a block level conversation, I don't think the most marginalized and the poorest people are being included in the voices. Number one, we are not creating a situation like, for instance, if I were to plan this as a civil society organization and my voice were to go up, I would create a conducive environment so that if women are leaving their jobs for the day, they are getting paid for coming and participating in the conversation that they are in part of today. Like, we cannot just again, like Manisha said, they're just not like they're not beneficiaries. They are part of the decision-making process. And also that ownership of the data that is getting developed or is being generated through the SDG India Index or other indexes that are being done, the multidimensional poverty index. I don't think people are in general aware of what is happening, what is the ground reality on things. So I think that ownership of data is also missing and is not being held by communities.
Yeah, and one, if I follow-up question. So this whole this whole block level kind of input that's unevenly present, if at all. And sort of, I'll use the phrase with your permission of this thing called the infrastructure of listening, right? So these infrastructures of listening, those are, would you say they so I've been to some of these things in different parts of India where the community kind of presents what they want, what they need, what their problems are. What do you think we've, as a system, we've not standardize some of this? Do you think we are using all the innovations that are possible right now? Are we using technology enough to actually listen to people, their needs? Because obviously, if there is a trade-off between a job, either the payment for missing that day's work has to be there, or you make it easier for them to tell you what they want, right? So do you think there's enough experimentation happening on just listening to people?
No, there isn't. That was one of the big points that I was going to come to with as a takeaway today, because number one, innovation also is not even happening at the higher ups. I think technology is being used, both used and misused, and I don't think innovation in this sort of work is happening at the ground level. I know it can get easier getting these voices up to the ground, having processes that make it easier for us to gather this information and give it back, because it's important to give it back. But I, in my work, have not seen it happen. There have been processes where they have collected data on, say, infrastructure available or natural resource available, just basic demographic information, almost like a survey again, sorry, Manisha, but more survey-oriented inputs, but nothing on innovation for bringing about sustainability at ground.
Okay. Let me turn to you now, Marchang. Let's go back to the whole labor market and improving labor market outcomes participation, and let's talk about women and indigenous communities. So let's just, you had touched upon some challenges, but let's double down and maybe even talk about, can you all hear me? I'm getting this pop-up. Can you hear me? Yeah, okay. Yeah. Yeah. So let's actually talk about women. Let's just women to begin with, right? And you talked about how when they go out, the participation rate is higher. So it means there is some patriarchy, there are some gender norms that operate that lead to a suboptimal equilibrium in the state for women. So can you just maybe sharpen that problem statement a little bit? And also, what are the approaches that you think can be deployed to improve labor market outcomes for women and maybe even indigenous groups?
Yeah, I think we need to segregate into two compartments. One is for the migrants, and one is for the non-migrants who are back home at the state of their origin. But considering the women and children, women and the indigenous communities, in particular for the northeastern region, yes, there are various challenges which needs an improvement, particularly for the outcome of the labor market. Outcome in terms of a couple of things. Outcome in terms of the employment participations. Outcome in terms of the work distributions, or even the waste distributions. I think those are the main features, particularly pertaining to the labor market outcomes. When we talk about labor market, it's about participation and income, in brief, in short. So what we see in this, what we notice, what we observe, what we evidence shows that in the northeastern states, particularly at the origin, the labor, I have mentioned some data, some explanation, particularly for the difference variations between the labor participations between the male and the female. Yes, of course, across all the states, labor force participation as well as the workforce participation rates are substantially lower for the females in particular, comparing with the males. Yes, that doesn't mean that labor force participation for the out migrants of women are lower than the males. That also I have mentioned. One feature which we should see in the labor market outcome is whether females are doing well or not, whether they are participating well or not, or whether they are performing or getting well salaried or not, or where are they participating in the regular wage employment considerably in comparison with their population proportions as well as the educational proportion or not. That is what we should see in the perspective of the performance of the labor market outcome. First, what we as I said, that the participation is lower in the northeastern states. Yes, there are various factors which we should see from the development angle, as well as infrastructure, industry, as well as educational level. The educational level, if we compare between males and females educational levels, particularly in the higher educational levels, graduate and above, is lower. I think that the problem starts, the concern starts there, not the problem. The concern starts there, the challenge starts there. But when we see the out migrants, irrespective of the gender, both have the qualifications of what you call what you call educated class, what normally we classify as those who have studied higher education and above education as educated people. So the out migrants are educated class, and maybe because of that, that is one of the argument, as well as one of the prescription, that education is owing to higher level of participation, particularly for the out migrants. The participation rate is higher in the SM out migrant comparing with the non-migrants. Yes, because of the differences in the pull factor, particularly in the job opportunities, leave alone the educational opportunities. The job opportunities which we see in the cities outside the northeastern states are a mixtures of opportunities which are not available in the northeastern states, even if it is available in the limited level, in the limited number of institutions, corporations, establishments. Because of that, the participations of women, even if there are young talented people, they tend to out migrate, thinking that they may have a better prospect being an out migrants in the cities, despite they may face various discrimination, prejudices, challenges. And the second thing is the participations in not participants, work distributions, whether they get a just work or the fair work or the fair employment, whether they are in the their aspired job, whether they are working in the job where men are also equally working, or whether they are having an exclusive employment avenues. Like, for example, we see particularly in like the Delhi, Delhi or certain manufacturing hubs, like the textile manufacturing hubs, we see the concentrations of females, which we call as the job crowding of the females in the manufacturing, textile manufacturing industry. Likewise, even in the industries which predominantly the female out migrants are working in the cities, like in the retail sector, hospitality sectors, as I said, as I have earlier mentioned. See, these are the places, these are the working and areas where they are concentrated. So does that mean that that implies that if the opportunities are available back home in the northeastern states, I think there is a possibility of retaining the, I think that is one of the questions which is being posed here. There is a possibility of retaining the talent which otherwise be unemployed. That means, in other words, the demographic dividends, of course, the younger populations can be used to not only get employment, but also to like capitalize, particularly to increase in the attractions of greater investments, particularly maybe from the private companies. Maybe that needs to be done by arranging certain things. Let me relate with that, which we have posed. Certain things, certain strategies. Like, for example, what we see is that the out migration, that is a brand trend, that is a labor trend, which otherwise be beneficial and maybe more contributing to the economy of the origin of the state. But it is unable to tap. The out migrants are being unable to tap or retain in the state of origin, mainly because their expectations are higher than what do you call the policymakers assume. And a graduate, technical graduates expect a higher paid positions, higher paid employment, and on top of that, even for the young talents, like the what you call startups, for example, the young talents, it is difficult. I have done certain studies, and even for the young talents back home at the origin, they are also difficult to survive. One thing is the difficulty to survive. difficulty of getting the government support as well as financial support from even from the nationalized banking systems, particularly because of the insecurity of insecurity of leasing, giving loans. And second thing is that the security, I'm talking about the security, which is the like insurgency issues, as well as the army, this national security, state security, this issue. This insecurity is also creating an environment to deviate from establishing certain startups as well as industries. Because of that, it's difficult to tap various talented skills for promoting, not only for employment, but also for promoting as well as generating other employment. And also, it is also important to see, particularly in the northeastern regions, because of the lack of media, because of the lack of control, and not lack of, because of the control of media by certain groups. You must be very aware of that. In certain media controls certain areas, certain informations, which I think you are aware of that. Because of that, the promotions of the industries or the startups or the activities or the establishments visibility is very limited. And third is, I also feel that maybe because of the big.
Arshang, if I may interrupt, we actually are now very close to the time. So if you let's give your closing comment.
Let me make a couple of more points. And also, yes, the concern of this, concerning the performance, but concerning the labor market outcomes, these challenges. Another main challenges is the wage inequality. Wage inequality, low wage paid in the origin, and comparing with the higher wage employment in the cities. Even the living cost is higher in the cities. I think for the time being, I'll stop there. If any questions, then I'll come back. Thank you.
Fantastic. So the way we have 25 minutes, I'm going to ask one question to Zipao, and then what we'll do after that, Zipao, may I request you to just answer that in a crisp, maybe 3-4 minute segment, and then we'll do a rapid fire round to all of you, which I will ask. And please keep it like super punchy, because we do want to keep about 15 minutes at the end for some audience questions which have been coming on the chat. So if that's all right with all of you. So Zipao, my question to you is coming back to the infrastructure piece, and you mentioned this whole people's road example, which was fantastic. But obviously, a lot of infrastructure only gets built if there is state support for it and funding for it. So, what would be your one kind of recommendation or one wish from the state to start doing things differently that leads to more equitable and more useful infrastructure for the region?
Well, I think I can answer that in less than 30 seconds. The need in terms of to shift the policy from security-centric to people-centric. Because we still have that colonial legacy of infrastructure for territorializations, infrastructure for securitization. So if we can twist that in terms of the policies focus from, security to the people, I think that's the answer way forward we have it.
You can add a little bit more detail. I think you maybe give a little bit of an example of what that might actually look like. Are there conversations that you've been part of, or are there initiatives you've seen that are trying to get that done?
In fact, in one of my paper, I was kind of trying to argue with, in the sense that given the context of Northeast, so the kind of the current crisis of infrastructure development, one way to forward or deepen this critical infrastructure is we might also need to come up with the separate commissions. So I was in fact pitching in for the level of, can there be a Northeast infrastructure missions be set up wherein all these centrally infrastructure projects are coming and monitored together in that very various aspects? Because what happening is that infrastructure are majorly funded by the central government, and of course there are private agencies that comes into the picture, and in terms of private investment in Northeastern is very less, but there are like a whole international funding organization that comes into it. But what happened is that when it penetrated in the state level, how it has been governed, it has changed the faces completely. So we really need to have this change in terms of governance of infrastructure. And also along with that, in terms of, of course, we talks about, many talks about good governance, effective governance, and what not things kind of people this thing. But the way can there be a place or a space where can we talks about the concept like engage governance, where people to make us equitable development partners, even in terms of this infrastructure development. In fact, this concept of engaged development is being coined by this body and Bipin Jojo in, very interesting discussions, particularly concerning about the tribal population in the context of India and not really limited to the Northeast. So I think there is a need to change in that very mindset and twist in terms of policy. So for instance, if I were to look at, in terms of this, which Supriya has pointed out in terms of localizations of sustainable development goals. So in these localizations of sustainable development goal, can one also look into what is the location and context specificity? In the sense that the kind of location as the Eastern Nagaland, it's very different from like in Kohima, Dimapur. So also the hill areas in Manipur vis-a-vis that of in the hill valley. So location and context specificity. If I were to take a rural road, I think that is one of the fertile ground which we have in the Northeast to experience that, to experiment that. Yeah, I'll stop here.
No, I love that. Location and context specifically, very, very, I think, clear. So thanks for that. So we'll do a rapid fire round, and I really would request you to keep it rapid fire. So 2 questions for all 4 of you, and I maybe just a 1 sentence or literally a 2-sentence answer. So the first question is, what are the ways in which the epistemology of development in Northeast can change for the better, right? So in other words, what can the development sector do? What can the policy sector do to make sure that the listening is better? What data, etc., what voices? So that's the first question, which is more of a process question, right? So what can we do better? And just 1-sentence answer. And the second question is the more tangible, given the pieces that you're working on. So let's say, Manisha, you're working in healthcare, Zipa in infrastructure, and so on. So what is, for that sector, what is your one thing that you would really want the development actors to do, right? So one is the listening question. How do we listen better and get the needs better data? And the second is the actual tangible thing that you wish were done. So please take a minute to think, because I really want you to restrict yourself to 1 sentence each, right? So, and whenever you're ready, we'll do it in whichever order that you want to go with. Okay.
I can
Okay.
go first.
Go ahead.
Yeah,
Manisha.
I think I'll keep it very short and sweet. My co-panelists have really emphasized on localization of policies and SDGs, etc. I think I agree, community participation, but also at the same time, multi-stakeholder participation, very, very essential at the governance level, whether you are sitting at the district, whether you're sitting at the state, whether you are convening together at a regional level, the multi-stakeholder has to be there. Health is not just for NHM. Nutrition is not just for social welfare. Everyone has to come together, and that is where development partners have to play a very, very critical role. This multi-stakeholder bringing together where there is space, and I think Supriya had very rightfully pointed out, a space which allows them to participate and articulate their needs. In my sector, per se, I think I will really encourage development partners to really sort of come together with the state to draft state health policies. This is one way in which this policy becomes a guiding light for bringing in these different determinants of health, that and the roadmaps for how we can achieve that. And that has been really, really transformatory, at least for Meghalaya, with the state health policy, that it has very distinctly recognizing the enabling factors that affects health, and health not just being about disease free or going to the facility, but so much more than that, and they are being able to execute it accordingly. So that's from my side.
Thanks, Manisha. Those were many sentences, but you were articulate, so that's fantastic. Okay, who wants to go next?
Should I come in?
Please.
Yes. So adding to Manisha's, because she just mentioned about policies, I'm going to take a step back and say, let's stop making policy documents. Let's revisit the ones we have. Let's use them properly. Let's take them to the communities. Let's listen to them. And then let's communicate back to them on what exists. These are the things they need. These are the changes we can do. We do the changes, go back to them. That's, I think, the change that is required. I'm keeping it extremely simple because I think there's no need to have more things. And also all state governments have, within the SDG vision planning, have developed, you have to remember each of the goals have a vision plan, which means they've already crafted these roadmaps. We have till 2030, then now there's another one for 2050. We've done enough of that. I think there has to be a pause and reflection on where we stand and what is the benefit of this.
Great. Thank you, Supriya. Zipa, do you want to go?
Yeah, I can come in quickly. I think we need an epistemological disobedience and need for this epistemic shift by revisiting and strengthening traditional institutions and promote traditional institution that promotes equality, questioning those institutions that, suppresses the rights of the women or different others sector, and also collective, decision making, and in terms of this intrinsic relationship, bring back to the nature and also the community, address both human and non-human agencies. Yeah.
Fantastic phrase. Epistemological disobedience. Disobedience. Sorry. I love it. Okay. Marshang?
Yes, concerning the epistemological process of development, I'll put in very simple words that I think we should, there should be a convergence for the development process as with a social responsibility. I think I'll keep that as short. And concerning the, what we can do, particularly with the area where I'm emphasizing and doing research, I think one of the features, particularly to relate with even for the Sustainable Development Goal 8, particularly for decent employment and for uplifting the marginalized or the deprived section of the community, particularly in terms of employment opportunities and the security for their livelihood. I think there should be, the government should initiate to institute the social security for securing the lives and livelihoods, particularly for the contingency and the hardships, or when they are sick, when they are old age, or when they have, the difficulties. I think that may help and elevate the marginalized communities, and also come with the parity with the higher order ways employ people, as well as the maybe access to the resources, particularly employment and income. That's it. Thank you.
Thanks, Marshang. Thanks very much. So I will now walk us through the audience questions, and most of them are actually targeted towards one panelist. So we have about, I think, 5 or 6 questions, and we've got about 15 minutes. So if I may request all of you just to keep your answers brief to a minute or two. So the first question, I'm just going to read from in the order that those questions were put down. So we'll start from the top, and I think there's a question for Manisha. Are there examples of successful healthcare programs that have been contextualized to the social context and local needs of the region? And how has the impact differed for these interventions?
So as I had earlier also mentioned, I think, and also something that Supriya had talked at the policy level, I think there are enough healthcare programs already existing. The sad part is Northeast is seen as the taker, like, these programs are designed keeping in mind the mainland India, but, it is assumed that Northeast will eventually also be implementing it. And that is where the contextualization is not happening. However, having said that, so if I look at the entire dynamics of community action for health, I think Meghalaya and Nagaland display that examples where they have woven, they have taken the entire example of the Village Health Sanitation Nutrition Committee, not as a standalone committee, but something woven within the community dynamics that already exists historically. That is the village council. So there is something called the Village Health Council. If you look up data and examples and case studies, tremendous work they have done. And I have for myself seen in Meghalaya how we have been able to sort of execute it so with so much ease and with so much acceptance from the community as compared to the difficulty we faced elsewhere. When it comes to other kinds of projects, I think the boat clinic is a very good example of how a program has been designed to sort of meet the need of a community that is otherwise not even part of any health review that happens, which is the community in the riverine islands that always get affected when floods occur, right? So, and the entire idea of boat clinic was to cater to this community with an A&M from the local area and an ASHA and nurses providing the primary healthcare services. This is this is what I can right away think of, and I'm sort of sharing. But I think in terms of such innovations, there is a lot more to be done in Northeast, and that comes with first appreciating, understanding the community dynamics. I'll really highlight this again and again. And in fact, and I think I don't know if Zipa or Marchang had mentioned, even within one particular state, there are so many dynamics. So that has to be done. We worked with tea garden areas, and we realized that the very VHSNC we are talking about will not apply for tea garden area, because there is something called a tea garden management. You have to acknowledge the presence of the management, but in the guidelines of the tea garden, this one, it's not happening. But having said that, development partners are coming up with such contextualized innovations. We are only hoping for the best, that there is more funding there, so that so many more such innovations also take place to address other aspects of health, other determinants of health, mental health being one of the more very sort of non-pronounced area, but so important. Yeah, thanks. I think I've answered that question.
Very well answered. So thanks, Manisha, for that. Let's go. The comment, I think, for Supriya, not really a question. The comment is, thank you for debunking the myth that the Northeast is very sensitive on matters of gender. So that's audience comment for Supriya. I know Supriya had a couple of comments and questions on women and violence, and also on migration. So maybe, Supriya, if you want to come in and just share your perspective in a minute or two.
Yeah, I'll share it in 2 lines. So actually, it was also a comment from Marchang, because when you were speaking of migration, most of the migration that happens, from my understanding from ground, not from research, is controlled primarily. The decision making is done by men, and hence the women's agency in making these decisions is usually much lesser. Second is the trafficking of women, which is also a huge part which was not addressed. And I think that is something that we need to talk about more openly, because there is trafficking. There's also huge amounts of violence against women when they are migrating from northeastern states to other parts of the country. I met a lot of victims who had during the lockdown. I think the first lockdown, they were stuck in Gujarat, Maharashtra, from around the country, and they were just locked up, and they were not paid, and they went through violence, and they came back absolutely traumatized. There was no health support. There was no mental health support, as Manisha pointed out. And it was just, I met them literally 6-7 months after, and they had still not received any support in the process. So there are these huge things that I think is still kind of under the radar, and we're not talking about as openly, but these are things that are affecting us in the Northeast a lot.
Thank you, Supriya. Really important point that you've raised. Okay, the next question is from Marchang. You've already covered this a little bit, but maybe just very quickly, if you can just, with your expertise on human resource development, how can the Northeast capitalize on the demographic dividend, and what specific strategies could be employed to retain young talent and promote entrepreneurship? So maybe a very crisp re-articulation on this, Marchang. Yeah.
I think partly I have mentioned that, particularly how to capitalize, particularly Northeastern the population demographic dividends, so the young population in particular. I think the strategies should be like from the community, from the individual to the government, not from the government to the individual. I think in the sense that the people should demand or portray or say what they want, what they aspire, and that should be projected through maybe media or through some agencies to reach the government agencies. Perhaps that may help in like deriving some success, particularly for their employment and their expectations on job and as well as wage. Yes. In terms of education, that the level of education varies, but and the higher education levels, particularly for the men, is a little on the higher side comparing with the women's. And also if we see the migrants, unemployment rates, the migration rates, the youths are the young demographic division are the one who are aspiring for a better job for out migration. So I think that it's high time that the government constitutes certain development development activities, particularly to retain the young populations, not only to promote the entrepreneurship, like because of the, as I have mentioned, about the lack of the finances and the various constraints, security constraints, and also you must be aware of in the area where insurgencies are there, the demands, which I mean, when there are parallel governments in various states, like in fact in Manipur there are many parallel governments. So it's difficult to establish certain entrepreneurs and to tap the young talents and to capitalize for further employment generations or further economic growth. I think it has to do with multiple perspectives, from multiple angles to create a good environment where establishments can be created, business can be run, and as well as the finance can be accessed, and also their outputs, their productions can be promoted as well as sell, and most importantly, maybe because of the underdevelopment in the nature of underdevelopment in the northeastern regions, particularly in the tribal population dominated areas, certain exemptions, relaxations on the, I'm particularly in the income should also be, considered.
Great. Thank you, Marchang. I'm going to rush us along. So the next question is for Zipao. So, and you've touched upon some of this, so maybe you can speak about the exact reforms. So the question is, in your view, how can infrastructure development in the Northeast be reimagined to focus on justice and inclusivity, particularly for tribal and indigenous populations who have been historically marginalized? What are some of the most urgent reforms needed to address these infrastructural injustices? So maybe just 1 or 2 reforms, Zipao.
Yeah, I can quickly respond to that. I think partly I've covered, but nevertheless, I think one of the urgent need is kind of, the frame of reference or the gaze that development policy needs to be revisited. If we continue with development policy or infrastructure development policy in the line of these extractivisms, it continue to perpetuate injustice to various communities. So deepening of these rural infrastructure, I think, is one way forward. And if I were to quickly make a comparisons between the budgetary allocations of mega infrastructure, say like Asian Highway number 1, and that of these PMGSY roads, there we see there's a huge difference in that aspect. In many of the rural Northeastern India, I think if we have these resilient roads, it will solve many issues. For instance, there are many people who goes to healthcare in bamboo stretchers. And there are also many places which are not accessible because of lack of these physical infrastructure like roads. So to simply put, the last comment from me is that in the places like Northeast, particularly in the hilly terrain or what is called the frontiers area, we need this infrastructural consciousness, like what Karl Marx talks about, class consciousness, Yeah.
Fantastic. Thank you for that. Supriya, this is about gender and epistemology in development programs for the Northeast. Why is the gender lens missing? How can we include women and marginalized groups in this?
Yeah, so I think it starts right from the beginning. When something is being planned, and if there's not enough data or like gender disaggregated data, we just start missing out right from the beginning. This has been spoken about for years. A lot of states have gender budgets, but the willingness in which it's done and how some of the allocations have been made, sometimes it's a bit of a joke, but sometimes it needs to be taken more seriously. That is the first point. Second, I mentioned it right at the beginning about representation of women. If women are not represented in political spaces and community spaces, if they have voice, some of the examples Manisha gave are excellent. Women have a voice, it makes an immediate change, whether be it health system, education system, wherever be it, in your village councils. Have your representation, it'll make a change. Another thing is resource allocation. I think, again, so much of it goes towards infrastructure per se, or goes towards other important needs that the resource allocated. And if we had the data and the resources, imagine what magic we could make together. And the M&E processes that are being implemented in some of the development projects, they're not very gender inclusive. And I think there needs to be more work on strengthening the M&E process and including gender. And by gender, I just don't mean women. I mean gendered lenses, all inclusion in the processes. And to Zepau's point, Northeast is not one homogeneous bit. We cannot make a development project for Northeast and just say, oh, now we will roll it out across every tribe, every culture. The social context, the cultural context is so different. You have to keep that in mind. Just one quick point, like the Niti Aayog has a Niti forum for Northeast region. I'm just putting it out there so that it's just information that you can have, and they have something called a joint working group, which is for the development of Northeast region. I was just going through some of the programs, and there was just basically strengthening existing programs. Now we have resources. We know that donor or NEC or there are resources that is available. How we use it is the question, and I think better planning is required in that front.
Thank you for that, Supriya. We're almost at time, but this is a super interesting question, and maybe I think I can maybe only have one of you answer that, which is is it fine if we go over by a minute, a couple of minutes? Is that fine with all of you, or if somebody has a hard stop?
Yeah, that is fine.
So the question is, what are your thoughts on the influx of vulnerable migrants from mainland India seeking employment in the Northeast? How should the region's development framework include or address the needs of these migrants, especially in the context of rising political tensions, such as in Assam, where anti-immigrant sentiment and violence against Muslims has escalated? So maybe if one or two of you want to come in very quickly, and we'll wrap it up with this.
Yeah, can I say something?
Please.
I think India being a very democratic country, as well as we are free to move and migrate and reside, settle any part of India. I think there is no harm in migrating from outside the northeastern region to the northeastern region. I think it also is their rights to, like we have the right to migrate, or that is our fundamental right, so we should respect and safeguard by the government as well by the respective states. And concerning the regions, I mean, how it can be included in the development framework, particularly by with the help of these migrants, I think there are scopes, because there are scopes for the maybe there are various scopes for employment opportunities. Employment opportunities are there. That's why they are migrating to the northeastern regions, which otherwise might not have migrated there. So, and people are, I mean, because of the choice of employment, people from northeastern peoples are also migrating to elsewhere states, and because of their choice, they are also migrating. There is no harm in migrating as well. I mean, influx in the state of Assam, even despite there are political issues, But yes, migrating, immigrations, particularly from foreign countries, I think that needs to be controlled and should have a concern, and diplomatically that should be dealt. But for the migrants, domestic migrants, I think government should also protect, particularly for the for the vulnerable migrant laborers. Let's say even the Kerala government, Karnataka governments are giving certain assurance, certain what we call development features for securing their lives and livelihoods by providing even some social security or some health benefits like that. So I think in the process of development in the northeastern regions, I think it may also be beneficial. It should be also beneficial for the northeastern regions to get some in-migrants, like out-migrants who are contributing to the other states. That's it. Thank you.
Fantastic. Thank you for that. We are at time. So I just want to maybe wrap things up. First of all, I truly, there's a lot of stuff to, we've covered a fair bit of ground. I think all the way from what are the unique needs, the barriers, how paradigm kind of shifts are needed, and covering across different pieces. This is obviously not the full story. Tomorrow we will actually do a slightly deeper dive into how do unique kind of strategies play out in different sectors. That's the second panel, which is at 4 o'clock tomorrow. And at 6 o'clock, we have another 2-hour panel, which focuses on the role of data and of capacity building. At the end of these 3 panels, hopefully we'll have a slightly fuller kind of piece on some of these nuances. But I just want to thank all 4 of the panelists. Thank you so much, Manisha, Supriya, Marchang, and Zipa. This was fantastic. Personally learned a lot, and I think the quality of the discussion was very, very high. And we were not very sure if we should actually block 2 hours or 90 minutes. And in the end, I'm so glad we did block 2 hours, which allowed us to go into a little bit of detail. I hope this was interesting for you as well. And thanks again for engaging. And yeah, I think that's it from all of us. Sanjana, anything else that you'd like to announce and close this with, or are we good?
Before she gives a closing remark, I also express my thanks to the hosts and for organizing this talk. And I also have I have educated much more by this discussion. Thank you.
Thanks. So no closing thoughts from my end. Just want to say that while the conversation was ongoing, I'm dining in from Sikkim, so there's been a power cut, and that adds one classic touch to the conversation we had. So yeah.
Okay. Thank you all. Thanks very much. And thanks to all the listeners who were listening in, both here and on the live streaming of EastMojo. Have a great Friday, and yeah, see you tomorrow. Bye-bye.
Bye-bye.